Basic medical expense insurance normally has a deductible and co-insurance, covers an illness but not an accident, pays for lost wages while hospitalized, has lower benefit limits than major medical insurance. The correct answer is has lower benefit limits than major medical insurance. Basic medical expense insurance covers both illness and accident, typically does not have deductibles and co-insurance, nor does it pay lost wages while hospitalized. Basic medical expense insurance typically has very basic benefits with daily limits. As the name suggests, basic medical insurance will have lower benefits than major medical insurance. With a basic medical expense policy, what does the hospitalization expense cover? Hospital room and board, hospital administration expenses, surgeon's fees, physician fees. The correct answer is hospital room and board. Basic medical expense hospitalization covers hospital room and board, miscellaneous hospital expenses, such as lab and x-ray charges, medicines, use of operating room, intensive care, and supplies. There is no deductible, and the limits on room and board are set at a specified dollar amount per day up to a maximum number of days, meaning all expenses may not be covered. Basic hospital and surgical policy benefits are lower than the actual expenses incurred, higher than the actual expenses incurred, normally subject to deductibles, normally subject to co-insurance. The correct answer is lower than the actual expenses incurred. Basic hospital and surgical policy benefits may not provide for the full amount of hospital room and board charges incurred by the insured. For example, if the hospital expense benefit was $200 per day and the hospital actually charged $400 per day, the insured would be responsible for the additional $200 per day. Which type of policy pays benefits to a policyholder covered under a hospital expense policy? Limited, special risk, reimbursement, blanket. The correct answer is reimbursement. A hospital expense policy is a reimbursement policy. This means the insured will be reimbursed for covered losses as determined by the terms of the policy. A limited or special risk policy will only cover specific risks like cancer or heart attacks. A blanket policy covers a specific group of people like students at a school or passengers on a plane. Which of the following costs would a basic hospital surgical policy likely cover? Surgically removing a facial birthmark, care given at a nursing home, treating a wound from a soldier injured at war, lost income caused by a hospital stay. The correct answer is surgically removing a facial birthmark. A basic hospital surgical policy would likely cover surgically removing a facial birthmark. A long-term care policy or social insurance policy would cover care giving at a nursing home. A hospital indemnity or disability policy would likely cover lost income caused by a hospital stay. A wounded soldier injured at war would be covered by the U.S. government. M is insured under a basic hospital surgical expense policy. A physician performs surgery on M. What determines the claim M is eligible for? Claim payment is equal to physician's actual charges. Claim payment is negotiated between physician and patient. Determined by the schedule of benefits from the hospital. Determined by the terms of the policy. The correct answer is determined by the terms of the policy. A hospital surgical expense policy will outline the reimbursement terms of the policy. The policy sets forth maximum reimbursement amounts, and these amounts may be less than what the physician or hospital charges. The insured would be responsible for paying anything above the maximum claim amount. All of the following statements about major medical benefits are true, except the deductible can be expressed as a fixed dollar amount. The benefit period begins only after a specified amount of expenses have accrued. Benefits are generally expressed as a percentage of eligible expenses. Benefits have no maximum limit. The correct answer is benefits have no maximum limit. The deductibles of a major medical policy can be expressed as a fixed dollar amount, whereas the benefits of a major medical policy can be expressed as a percentage of the eligible expense. Normally, the benefit period of a major medical plan does not begin until after a specified amount of expenses have accrued. Major medical benefits usually have an annual maximum limit. Comprehensive major medical policies usually combine major medical with disability income coverage, major medical with basic hospital surgical coverage, basic hospital surgical with accidental coverage, basic hospital surgical with disability income coverage. The correct answer is major medical with basic hospital surgical coverage. Comprehensive major medical is basically an all-inclusive policy. It combines a major medical policy with basic hospital surgical coverage to provide one-stop shopping for all of your medical expenses. A comprehensive major medical health insurance policy contains an eligible expenses provision which identifies the types of healthcare services that are covered. All of the following healthcare services are typically covered except for hospital charges, physician's fees, experimental and investigative services, nursing services. The correct answer is experimental and investigative services. Most major medical health insurance policies will not pay for experimental and investigative services. Basically, the insurance company does not want to spend money on services that have not yet proven to be successful. Which of the following phrases refers to the fees charged by a healthcare professional? Deductible, coinsurance, usual, customary, and reasonable expenses, hospital expense. The correct answer is usual, customary, and reasonable expenses. Remember, usual, customary, and reasonable expenses only apply to fees paid by the insurance company to the healthcare professional. They will never involve fees paid to or by the insured. Which of the following statements best defines usual, customary, and reasonable charges? The maximum premium an insurer can charge for their health insurance based on geography. The maximum amount an employer can contribute to a contributory health plan. The maximum deductible an insured can be charged. The maximum amount considered eligible for reimbursement by an insurance company under a health plan. The correct answer is the maximum amount considered eligible for reimbursement by an insurance company under a health plan. Under the usual, customary, and reasonable approach, the surgical expense is compared to what is deemed reasonable and customary for the geographical part of the country where the surgery was performed. The usual, customary, and reasonable approach is the maximum amount an insurer will consider eligible for reimbursement under a health insurance plan.